The morning sun cast long amber shadows across the rust-colored earth of the Samburu National Reserve, where the acacia trees stood like ancient sentinels against the endless equatorial sky. It was the absolute peak of the dry season, a brutal period of environmental extremity, where the landscape had been reduced to a brittle mosaic of cracked mud and withered scrub brush that crunched loudly beneath the heavy tires of the mobile veterinary unit. Heat waves were already beginning to distort the horizon, turning the distant silhouettes of flat-topped mountains into trembling optical mirages that danced over the baking plains. In this unforgiving climate, survival was dictated by an extreme conservation of energy and moisture. Every wild inhabitant of the reserve operated under a constant baseline of physiological stress as shrinking waterholes forced competing herds into dangerously close proximity and stripped away the normal buffers of territorial spacing. The sheer absence of moisture hung in the atmosphere like a physical weight, drawing the vital fluids from the vegetation and leaving the earth smelling of baked dust and ancient salt. Marcus Thompson stood at the rear of the modified 4x4 vehicle, slowly wiping a thick layer of fine red dirt from the heavy olive-drab hardcase known as their clinical field kit. As a highly experienced field veterinarian, he valued clinical observation above all else, maintaining a calm and measured demeanor that routinely kept both his team and their massive patients safe in highly unpredictable scenarios. Beside him, Kofi Mensah quietly organized a row of sterile syringes and diagnostic equipment along the metal tailgate. The assistant veterinarian was a remarkably practical technician who specialized in monitoring wildlife vitals under high-stress conditions, and his hands moved with an practiced efficiency that required no verbal communication. He noted quietly to his colleague, without looking up from the sterile packaging, that the ambient temperature was already climbing past 90 degrees, predicting a dangerously hot morning for any required field operations. A sudden shift in the atmospheric pressure signaled an arrival long before any physical sound reached the human ear. It began as a deep infrasonic rumble that rolled through the parched ground, traveling beneath the topsoil and resonating directly within the chest cavities of the two men. Marcus paused his work, leaving his hand resting lightly on the reinforced lid of the clinical field kit. He turned his gaze slowly toward a dense thicket of Commiphora bushes, approximately 100 meters to their left, where the dry branches parted with a heavy, deliberate snapping of wood that shattered the oppressive silence of the morning. A massive form materialized from the gray mist and fine dust that hung perpetually in the arid air. It was a fully grown savanna elephant, but the distinct jagged notch on her left ear and the violently asymmetrical curve of her right tusk identified her immediately to the seasoned veterinary team. This was Saba of Samburu. She was a famously aggressive wild matriarch with a deeply documented history of charging vehicles and terrorizing ranger patrols across northern Kenya. In the harsh calculus of elephant survival, she had learned through decades of navigating a landscape scarred by ivory poachers and severe seasonal droughts that preemptive hostility was the only effective defense against human encroachment. Previous field reports detailed multiple incidents where the fierce female had shattered windshields and flipped research buggies to protect her generational herd from perceived threats. Standard operating procedure for encountering this specific animal dictated an immediate and silent evacuation, avoiding eye contact and removing all machinery from her immediate path. Her baseline cortisol levels were presumed to be permanently elevated, making her a highly volatile apex herbivore, capable of obliterating the small medical truck with a single calculated strike. Kofi instinctively moved his hand toward the vehicle's open driver's side door, keeping his body language minimal but ready to turn the ignition key at the first sign of a threat display. But the expected biological markers of an impending attack were entirely absent, defying everything the two men knew about this particular matriarch's behavioral history. There was no aggressive posturing to establish dominance, no sudden jerking of the head or kicking of the red dust to signal an impending charge. Her temporal glands remained completely dry, showing absolutely none of the dark viscous secretion that typically streamed down the sides of an elephant's face during periods of severe agitation or territorial rage. Her massive ears, which would normally flare out widely to create a terrifying visual wall designed to intimidate predators, were instead pinned flat against the thick muscles of her neck, indicating a profound state of physical and emotional exhaustion. She was moving with an agonizing slowness that defied her colossal size. The matriarch placed each columnar leg onto the dry earth with excruciating care, as if the slightest impact might shatter something incredibly fragile. Marcus narrowed his eyes against the rising glare of the sun, focusing his clinical vision on the heavy gray bundle cradled securely in the deep protective curve of her muscular trunk. It was a newborn calf. The tiny creature hung entirely limp, swaying slightly in rhythm with the mother's measured footsteps. Its small trunk dangled lifelessly toward the dirt, and its thin legs dragged limply through the tops of the withered grass, leaving a shallow parallel trail in the sand. The veterinary team stood absolutely frozen beside their vehicle, caught in a paralyzing paradox between the professional instinct to intervene medically and the primal terror of facing a defensive mother whose reputation for violence was legendary. The silence of the reserve became deafening as the massive female closed the distance, moving steadily through the sparse brush. Marcus stood absolutely motionless, tracking the trajectory of her heavy footfalls and feeling the rhythmic thud reverberate up through the soles of his boots without daring to take a single breath, fearing that the slightest exhalation might break the fragile spell of her advance. The gap between the wild predator and the human clinicians closed with terrifying inevitability. 30 meters, 20 meters, 10 meters. Marcus remained rooted to his position beside the rear tire, keeping his posture relaxed and his hands entirely visible at his sides, demonstrating an absolute lack of hostility. He knew from years of behavioral observation that the slightest sudden movement or a sharp metallic sound from the truck could instantly trigger the suppressed amygdala of the grieving mother and provoke an explosive defensive reaction that would end in catastrophe. Saba loomed directly over the mobile veterinary unit, casting a vast, cooling shadow over the hood of the dusty vehicle and the two men standing rigidly beside it. She was close enough now that Marcus could distinctly smell the sweet, dusty scent of crushed acacia leaves on her slow exhalations and trace the intricate map of deep sensory wrinkles across the surface of her massive trunk. She stopped her forward momentum entirely. Her deep amber eyes locked onto the lead veterinarian with an intensity that held no malice, but rather a profound physical and emotional exhaustion, a desperate plea communicated across the silent divide of species. Slowly and with a mechanical precision that belied her 5-ton bulk, the famously aggressive elephant lowered her massive head toward the ground. She uncoiled the thick muscles of her trunk and gently deposited her limp newborn directly onto the dry grass at the veterinarian's boots. The physical placement was astoundingly deliberate. The 75-kilogram calf slid softly from her protective grasp, coming to rest, with its small gray forehead leaning flush against the scuffed brown leather of Marcus's left shoe. Looking down at the motionless bundle, the clinician immediately processed the critical nature of the emergency, seamlessly shifting from a state of physical apprehension to acute medical focus. This was Kidogo calf, and the newborn was exhibiting clear clinical signs of extreme physiological collapse. The tiny animal's skin was unnaturally dry and deeply wrinkled, lacking the healthy elasticity that characterizes a properly nursed and hydrated infant. A distinct and alarming metallic odor drifted up from the creature's abdomen, specifically originating from an unhealed and severely inflamed umbilical stump that throbbed with a dark necrotic heat. The swollen tissue indicated a massive localized infection that had likely developed into acute systemic septicemia, pumping lethal bacteria directly into the infant's vulnerable bloodstream and initiating the terrifying cascade of neurogenic shock. Kidogo's respiratory rate was dangerously erratic, consisting of rapid shallow gasps that pulled violently at his fragile ribcage in a desperate bid to oxygenate failing internal organs. The calf was radiating an intense, unnatural heat that Marcus could feel even through the thick leather of his boots, a raging fever that threatened to permanently damage the animal's delicate neurological architecture if not brought under control immediately. Having surrendered her most precious biological asset, the veterinary team braced themselves for the matriarch to establish a tight defensive perimeter over the fallen body. They fully expected her to stand astride the dying infant and challenge the humans to dare step closer, asserting her dominance and protective instincts even in the face of insurmountable tragedy. Instead, the enormous female executed a maneuver that would completely challenge everything they thought they knew about wild animal behavior and maternal instincts. Saba exhaled a long, low breath that stirred the fine red dirt around the human's ankles. She lifted her trunk, trailing the highly sensitive bifurcated tip over the calf's trembling flank one final time in a heartbreaking micro-movement of maternal grief, taking in the scent and the fading warmth of her offspring. Then she deliberately took a slow, agonizing step backward. She did not rush or vocalize any distress calls to a distant herd, nor did she disappear entirely into the dense brush, abandoning the calf. The matriarch simply turned her colossal frame away from the medical truck and began to walk backward, retreating with a measured, rhythmic pacing, until she reached a cluster of Kamaphora bushes, precisely 50 meters away from the veterinary unit. There, she stopped. She pivoted her massive body to face the humans once more, planting her front legs squarely in the dirt and taking up a silent, vigilant stance beneath the sparse shade of an acacia tree. To willingly hand over a critically ill newborn to a recognized environmental threat and then retreat to a calculated distance of observation required a staggering cognitive override of every evolutionary imperative hardwired into her brain. Her highly developed nervous system had somehow calculated that the absolute certainty of the calf's death in the wild outweighed the immense risk of human proximity, making the deliberate choice to allow medical intervention while maintaining a watchful perimeter. This calculated surrender indicated an understanding of not just physical survival, but psychological well-being, demonstrating a level of reasoning that transcended species boundaries. Marcus stared at the massive mother, holding her position exactly 50 meters away, yielding her immediate territory, but never her maternal duty. He then looked down at the shivering, infected infant resting against his boot, recognizing the profound weight of the silent interspecies contract that had just been signed in the Samburu dust. The massive matriarch remained entirely anchored beneath the sparse canopy of a solitary shade tree, her towering silhouette casting a long, dark shape against the shimmering optical distortions of the baking horizon. At exactly 50 meters, she had established a deliberate perimeter that satisfied both her fiercely protective maternal instincts and the pragmatic necessity of allowing the clinicians the physical space required to work. Saba of Samburu was not merely resting in the heat, but actively engaged in a state of high-alert sensory processing that demanded an immense expenditure of cognitive energy. She stood completely motionless, yet her highly specialized olfactory system was pulling continuous data from the dry wind, analyzing the chemical signatures of the veterinary equipment, the metallic tang of medical alcohol, and the distinct hormonal scent of her dying offspring. Her trunk rested lightly against the baked earth, acting as a highly sensitive seismic antenna that picked up the microscopic vibrations of the humans shifting their weight in the dust. To maintain this agonizing distance while watching a recognized apex predator handle her newborn required an unparalleled suppression of her own amygdala. She was forcefully overriding decades of accumulated trauma and defensive conditioning, choosing to endure the agonizing psychological tension of separation, because her deep ecological intelligence recognized that her own biological tools were entirely insufficient to halt the infection ravaging the infant. Down in the suffocating heat of the open dirt, Marcus Thompson dropped slowly to his knees, ensuring that the geometry of his body remained low and entirely devoid of any sudden predatory intent. He placed his bare palms directly onto the thick gray hide of Kidogo calf, feeling the rapid, erratic fluttering of a tiny heart struggling to push thickened, dehydrated blood through a failing cardiovascular system. The clinical reality of the situation unfolded rapidly beneath the lead veterinarian's fingertips as he mapped the topography of the infant's collapse. The small patient's skin lacked the supple elasticity necessary for thermoregulation, remaining pinched and tented when Marcus gently pulled at the folds behind the neck, indicating a state of profound cellular dehydration. A single drop of human sweat rolled down the doctor's forehead and stung his eye, but he did not break his focus, simply blinking away the salt as he traced his hands down the shivering flanks toward the source of the overwhelming necrotic odor. The umbilical stump, which should have been a cleanly severed and rapidly drying seal against the outside world, was instead a swollen, weeping mass of deeply inflamed tissue. In the harsh calculus of elephant survival, a newborn's unhealed navel represents a profound and potentially fatal vulnerability to the microscopic ecosystem of the savanna. During years of normal rainfall, a mother would instinctively guide her calf to clean mud wallows, packing the fresh wound with cooling protective earth that acts as a natural barrier against pathogens. But the brutal extremity of the current dry season had eradicated those essential mud baths, leaving the open tissue exposed to the relentless dust and opportunistic bacteria of the scrubland. Marcus noted quietly to his colleague that the localized infection at the site had definitively breached the abdominal wall and entered the vascular system, triggering the terrifying physiological cascade of acute systemic septicemia. The invading bacteria were now multiplying exponentially within the bloodstream, releasing toxic byproducts that overwhelmed the calf's immature immune responses and initiated a catastrophic state of neurogenic shock. The newborn was completely unresponsive to tactile stimuli, not even twitching an ear, when the veterinarian firmly palpated the swollen lymph nodes beneath its jawline. Kofi Mensah moved with deliberate quietness around the rear of the vehicle, retrieving a heavy-duty digital thermometer from the sterile confines of the clinical field kit. He handed the instrument down to the kneeling doctor, keeping his own body profile minimized and his movements fluid to avoid drawing any sudden attention from the watchful mother 50 meters away. Marcus carefully lifted the limp tail of the newborn and inserted the diagnostic tool, waiting in the oppressive silence of the reserve for the internal reading to stabilize. When the digital display finally locked, it confirmed the absolute worst of their clinical suspicions, registering a critical core temperature of 104 degrees Fahrenheit. This was not merely a fever but a thermal inferno that threatened the fundamental architecture of the animal's central nervous system. At this extreme temperature, the vital proteins within the infant's brain tissue were at immediate risk of denaturing and beginning to literally break down a process that would lead to irreversible neurological damage or fatal seizures within the hour. The universal language of loss and loneliness seemed to hang heavily in the baking air as both men recognized the incredibly narrow window of time they had left to reverse a physiological collapse of this magnitude. Working directly on the powdery red dirt required a level of meticulous sterile technique that contrasted sharply with the chaotic and contaminated reality of the wild environment. The veterinary team seamlessly initiated an aggressive course of emergency treatment without exchanging a single unnecessary word, their workflow dictated entirely by years of shared experience in extreme trauma situations. Kofi knelt beside the abdominal region and began to aggressively sterilize the infected umbilical site, saturating thick woven gauze pads with dark brown povidone iodine. The strong chemical scent of the surgical scrub immediately mixed with the dry dust and the sweet decay of the infection, creating a sharp olfactory boundary around the mobile clinic. The assistant veterinarian scrubbed the inflamed tissue with a firm, repetitive pressure, working to clear away the necrotic debris and establish a clean perimeter around the primary source of the septicemia. Kidogo remained entirely flaccid during this abrasive cleaning, a deeply alarming lack of pain response that further confirmed the depth of the neurogenic coma trapping the young mind in darkness. While the primary infection site was being secured, Marcus shifted his intense focus to the expansive canvas of the calf's left ear, draping the leathery appendage over his thigh to expose the intricate vascular network beneath the skin. In a healthy elephant, these prominent auricular veins serve as a highly efficient thermal radiator, pumping massive volumes of warm blood to the surface to be cooled by the flapping motion of the cartilage. However, the profound systemic shock and severe dehydration had caused the infant's peripheral vascular system to collapse, entirely withdrawing the remaining blood volume into the core to protect the failing vital organs. Finding a viable entry point in a collapsed vein required an agonizing level of tactile precision. The clinician pressed his thumb deeply into the base of the ear, acting as a temporary tourniquet, while his index finger traced the invisible pathways beneath the gray epidermis, searching for the microscopic rebound of a fading pulse. He wiped a small patch of skin with surgical alcohol, watching the clear liquid evaporate instantly in the 90-degree heat, before utilizing a specialized intravenous ear catheter designed specifically for thick-skinned mammals. The mechanical click of the heavy-gauge needle piercing the tough hide sounded exceptionally loud in the quiet isolation of the plains. Marcus held his breath as he advanced the plastic tubing, maintaining a perfectly shallow angle until a tiny brilliant flash of dark venous blood appeared in the clear plastic hub of the catheter. It was a microscopic victory that provided the vital gateway needed to pull the patient back from the edge of physiological ruin. He immediately secured the line with multiple layers of wide white medical tape, pressing the adhesive firmly against the dusty skin to ensure the thrashing of a potential seizure would not dislodge their only vascular lifeline. With the port-established, Kofi swiftly attached the first large plastic syringe directly to the hub, pushing a massive initial dose of broad-spectrum cephalosporin antibiotics straight into the struggling cardiovascular system. The pharmacology of the medication was specifically selected for its ability to rapidly penetrate and shatter the cell walls of the multiplying bacteria, initiating a highly aggressive counterattack against the pathogens flooding the newborn's blood. Yet the pharmacological intervention alone would be entirely insufficient if the critical core temperature was not immediately suppressed. To combat the lethal 104-degree fever, the technicians suspended 2 heavy-liter bags of chilled eye fluids from the side mirror of the dusty 4x4, allowing gravity to force the cold crystalline liquid down through the long plastic tubing and into the fragile vein. The cold saline solution served a dual medical purpose, rushing to replace the massive fluid deficit, causing the Sylchiol dehydration, while simultaneously acting as an internal coolant, dropping the core thermal reading from the inside out. As the clear liquid began its steady, rapid drip within the plastic chamber, Marcus leaned back slightly on his heels, wiping his forearms with a sterile towel and allowing his own elevated heart rate to stabilize. They had deployed every chemical and mechanical tool available in their arsenal, altering the internal chemistry of the dying organism with extreme clinical prejudice. Now they entered the most agonizing phase of wildlife conservation medicine, where the humans were forced to retreat into the role of silent observers, waiting to see if the fragile biological architecture of the calf possessed the resilient strength required to accept the chemical bridge they had just built. The equatorial sun climbed higher, bleeding the color from the morning sky, until it became a brilliant, punishing white, pressing down upon the rust-colored earth of the Samburu National Reserve. The silence that followed the initial medical intervention was not an absence of sound, but a dense physical weight composed of heat and tension, and the steady, rhythmic dripping of chilled saline flowing through the thin plastic tubing into Kidogo Calf. Kofi Mensah remained frozen in a statuesque kneel, holding the heavy reservoir of intravenous fluids high above his shoulder to ensure gravity maintained the precise flow rate required to flush the critical thermal load from the newborn's collapsing vascular system. The clear fluid suspended inside the heavy plastic reservoir, harvested from the deep coolers of the mobile veterinary unit, was slowly warming in the ambient heat, requiring a continuous and unabated flow to maintain its internal cooling properties against the overwhelming fever that threatened to consume the tiny patient. The physical mechanics of his posture demanded immense muscular endurance as the minutes stretched into the first, grueling hour of observation, but the quiet field technician understood that any sudden shift or sign of human fatigue might shatter the fragile perimeter of trust they currently inhabited. Sweat pooled in the hollow of his throat and tracked slowly down his sternum, yet he did not blink, keeping his focus locked entirely on the clear chamber where life was being metered out drop by microscopic drop into the peripheral circulation of the dying animal. He was functioning as a human IV pole, a living extension of the clinical apparatus bound to the parched earth by the gravity of the situation. Exactly 50 meters away, standing precisely where she had retreated, the immense silhouette of Saba of Samburu dominated the landscape. She was a matriarch whose reputation for fierce territorial aggression was written in the scarred bark of the reserve's acacia trees and the crushed fenders of ranger patrol vehicles. Yet now she remained anchored to the sparse, mottled shade of a solitary tree. Her restraint was an ethological anomaly that defied decades of observational data and would challenge everything they thought they knew about elephant maternal instincts. In the harsh calculus of elephant survival, a mother was programmed by millions of years of evolution to charge, to crush, and to annihilate any predator hovering over her vulnerable offspring. Instead, she engaged in a profound display of displacement behavior, an obsessive physical outlet for the surging adrenaline she was actively suppressing. Slowly, rhythmically, her heavy front foot kicked at the dry, sun-baked earth, sending small clouds of amber dust drifting over her scarred knees, while her trunk swung in a tight, agitated pendulum motion, brushing the ground without truly resting, as if searching for a tactile connection that wasn't there. Dark streaks of fluid wept freely from her temporal glands, staining the rough topography of her face as a visible physiological marker of the surging cortisol flooding her central nervous system. This was the architecture of maternal terror, held perfectly in check by an invisible cognitive boundary. She did not charge, but she did not look away. Her ancient amber eyes tracked every micro-movement the veterinarians made processing the alien intrusion through the remarkable architecture of an elephant's brain that remembers every cruelty but possesses the capacity for staggering interspecies empathy. The space between the mother and the medical team vibrated constantly with a low, continuous infrasonic rumble pitched far below human hearing. It was a frequency that Marcus Thompson could feel resonating upward through the thick rubber soles of his boots, a seismic transmission of grief and watchfulness traversing the distance and binding the three species together in the oppressive heat. It spoke the universal language of loss and loneliness, demanding nothing but offering a terrifying reminder of the lethality standing just beyond their peripheral vision. As the morning ticked relentlessly toward noon, the ambient temperature of the savannah soared, pushing the physiological limits of the humans working entirely without shade. 2 hours passed, then 3. The clinical reality of severe umbilical sepsis dictated that the heavy viscous cephalosporins currently racing through the dark vascular pathways of the calf required time to bind to the bacterial cell walls and halt the microscopic replication that had hijacked the tiny immune system. There was no miraculous instantaneous recovery in wildlife conservation medicine. There was only the agonizing grind of pharmacology warring against pathology within a biological vessel hovering on the edge of neurogenic shock. Marcus knelt directly over the motionless gray mound of Kidogo calf, his gloved hands performing a continuous loop of tactile diagnostics. He pressed 2 fingers against the pulse point just beneath the jawline, mapping the erratic, fluttering rhythm of the failing heart against his own skin. He noted the profound dehydration pulling the skin tight over the fragile ribs, and he watched the shallow, rasping rise and fall of the lungs, struggling to oxygenate a system choked by systemic inflammation. Every 15 minutes he gently withdrew the digital thermometer from the clinical field, it keeping his movements incredibly slow and predictable so as not to startle the watching mother. He would slide the probe into position and wait for the rapid blinking of the display to stabilize within the stifling stillness. At Aero 9:30, the reading remained locked at a catastrophic 104 degrees Fahrenheit. At 10:15, it had barely shifted, reading 103.8 degrees. The complex proteins of the animal's neurobiology were still trapped in an invisible fire, burning the calf alive from the inside out. Marcus did not speak the numbers aloud to Kofi. He merely logged them in his mind, absorbing the bleak trajectory of the data while monitoring the intravenous ear catheter taped securely to the flattened ear. The marginal auricular vein, which had been entirely collapsed upon their arrival, was now slightly distended, bearing the continuous influx of the chilled saline that was slowly diluting the toxic buildup of lactic acid and forcing the sluggish heart to pump with renewed mechanical vigor. This wasn't just a medical problem, but a profound test of endurance, where not just physical survival, but the psychological well-being of the entire matriarchal line hung in the balance. By the time the 4th hour of continuous treatment approached, the air above the Samburu Plains was shimmering with a thick liquid distortion of heat haze that blurred the line between earth and sky. Kofi's shoulder muscles were locked in deep, sustained spasms from the sheer, unbroken physical exertion of elevating the heavy fluid reservoir. The bag itself had slowly deflated over the hours, its life-saving contents transferred entirely into the vast interior darkness of the elephant calf. Kofi executed a microscopic weight shift, transferring the burden from his right arm to his left with a smooth glacial grace that produced zero visual disturbance for the hypervigilant mother watching from the acacia shade. His face was a mask of stoic concentration, his breathing synchronized entirely with the rhythmic dripping of the chamber. They were pouring their own vital energy into the hollowed-out frame of the newborn, establishing an invisible bridge between species constructed of sheer willpower to sustain the failing organism until the medication could find purchase. Marcus leaned closer to the calf, his clinical gaze analyzing a sudden microscopic shift in the physiological presentation. The shallow, erratic rasping that had characterized Kidogo's breathing since the morning began to deepen. The sharp, desperate hitches in the chest cavity smoothed out into longer, more deliberate pulls of oxygen, expanding the fragile rib cage against the unforgiving earth. The dry gray skin, which had felt like sun-baked parchment beneath Marcus's fingertips, all morning was suddenly slick with a faint trace of moisture behind the ears. The thermoregulatory system was slowly coming back online. Marcus reached for the thermometer one final time as the chronological marker hit 12:30. He inserted the probe and watched the digital numbers climb rapidly before slowing, hesitating, and finally locking into place. The display read 101.2 degrees. The fever had broken. The heavy blanket of severe thermal crisis that had threatened to cook the cerebral tissue and trigger multi-organ failure was actively lifting as the broad-spectrum antibiotics finally overran the bacterial epicenter of the necrotic umbilical site. The chilling effect of the intravenous fluids had successfully preserved the internal architecture, allowing the infant's suppressed immune system to rally from the brink of total collapse. A long, shuddering exhale escaped the tiny trunk, blowing a small circle of dust away from the cracked earth. It was the first voluntary motor function the calf had exhibited in 4 hours, followed by a weak but deliberate flutter of its leathery ear. Marcus allowed his eyes to close for a fraction of a second, exhaling a breath he felt he had been holding since 0830. He slowly looked up, meeting Kofi's gaze, and gave a single microscopic nod, acknowledging that sometimes the most profound healing happens in absolute stillness. The quiet field technician allowed his jaw to relax, lowering the empty plastic bag by a few inches as the realization washed over them both. The aggressive pharmacological counter-offensive had worked. In the deep, heavy silence of the savannah afternoon, the fragile biological machinery of Kidogo Calf had chosen to restart, and 50 meters away, Saba of Samburu let out a low, resonant rumble that vibrated through the deep earth, shifting its pitch from a frequency of primal terror to the slow, steady cadence of a mother sensing the turning of the tide. Marcus Thompson checked his digital thermometer, shielding the small liquid crystal display from the harsh equatorial glare with a cupped hand. The screen read a perfectly stable 101, 2 degrees Fahrenheit down from the critical 104 that had threatened to permanently boil the infant's neurological pathways just 4 grueling hours earlier. The systemic septicemia was no longer dictating the biological narrative of this tiny creature. Kidogo Calf drew a long, shuddering breath that expanded the fragile rib cage against the dust-coated earth, pulling in the dry scent of the surrounding acacia brush. A single gray ear twitched against the ground. It was a voluntary movement, a microscopic assertion of life, returning to a biological vessel that had only hours ago been entirely surrendered to the dark void of neurogenic shock. Marcus gestured silently toward the heavy olive-drab hard case, sitting open in the dust, its compartments lined with the depleted vials of their desperate pharmacopoeia. Kofi understood the command without a single syllable spoken between them. The time for human intervention had passed, and the delicate protocol of psychological autonomy had to begin. The assistant veterinarian knelt beside the massive domed head of the newborn, moving with the glacial fluidity of a man who understood that sudden movements could shatter the fragile architecture of trust they had just spent hours building under the watchful eye of a predator. He reached for the intravenous ear catheter still securely taped to the collapsed auricular vein. Removing the line was a procedure fraught with both physical and ethological peril. If the calf panicked or vocalized in pain, the 50 meters of agonizingly negotiated distance between them and Saba of Samburu would evaporate under a sudden 5-ton charge. The clinician applied a sterile gauze pad over the delicate insertion site, pressing down with deliberate measured force, before slowly withdrawing the specialized sterile needle and thin plastic tubing. Kidogo Calf did not flinch. The infant simply continued the deep rhythmic breathing that signaled the transition from critical illness into natural restorative sleep. Kofi maintained the pressure for 3 full minutes, watching the digital chronometer on his wrist, while the afternoon sun beat down upon his shoulders, painting the sky in shades of amber and gold as the heavy dust motes danced lazily in the rising thermals. He finally lifted the gauze. The auricular vein held perfectly. The umbilical stump was heavily coated in dark povidone iodine, a stark, unnatural chemical stain against the soft gray wrinkles of the newborn's skin, but the necrotic debris was gone, and the surrounding tissue felt mercifully cool to the touch. They had to meticulously erase every trace of their clinical presence. Every used syringe, every empty saline bag, every blood-spotted alcohol swab was silently catalogued and secured within the clinical field. The sharp metallic clicks of the latches snapping shut were muffled by calloused hands to preserve the profound silence of the savannah. Marcus closed the lid and looked down at the tiny sleeping form one last time, feeling the profound crushing weight of what they had just engineered. This was not just a medical problem. This was a problem of the soul. The physiological parameters were stable, but in the harsh calculus of elephant survival, a calf without a mother is a calf without a future. They had merely bought the infant time against the relentless clock of dehydration and infection. Now the mother had to choose to take the calf back despite the overpowering olfactory contamination of human interference. Marcus and his assistant slowly stood. They lowered their profiles, hunching their shoulders to minimize their physical presence, and began the agonizingly slow retreat toward the mobile veterinary unit parked nearby. Every step backward was a calculated exercise in submission. They dragged their boots slightly in the loose, dry soil to avoid snapping twigs, keeping their eyes averted from the massive matriarch still standing like an ancient sentinel beneath the acacia tree. They were deliberately creating a vacuum, an invisible bridge for nature to cross back over. By 12:45, the two veterinarians were sitting silently inside the stifling cab of their vehicle with the engine off and the windows rolled down, listening to the vast rhythmic heartbeat of the Samburu Reserve. The silence became deafening pressing against their eardrums. Marcus rested his hands on the steering wheel, his knuckles white as he watched the scene unfold through the heat-distorting haze of the afternoon savannah. On the baked ground, Kidogo calf stirred. The biological imperatives encoded over millions of evolutionary years began to fire within the developing cortex, overriding the lingering lethargy of the cephalosporins. The calf let out a weak, reedy squeak. It was a sound pitched so low and frail it barely disturbed the dust, but it carried the undeniable primal urgency of a creature, suddenly aware of its own terrifying isolation in a world of predators. The front knees bent inward, finding clumsy purchase in the dry soil. With a desperate heave, the infant pushed upward. The back legs, uncoordinated and trembling violently beneath the sudden demand of gravity, joined the monumental effort. For a long, agonizing minute, the calf swayed like a ship caught in a squall, the oversized ears acting as erratic counterweights against the relentless pull of the earth. But the stance held. 50 meters away, the massive form of Saba of Samburu detached from the cooling shadow of the acacia tree. She did not charge the vehicle, she did not trumpet her ancient rage against the metal intruders. She simply moved with a slow, fluid grace that seemed to defy her immense physical mass, gliding across the savannah without producing a single seismic tremor. The air grew thick with the low, resonant hum of her infrasonic vocalizations, a deep, continuous vibration that rattled the loose surgical steel tools inside the clinical field and reverberated directly against the human sternum. It was a sound of profound inquiry and deep somatic reassurance spanning the invisible gap between mother and child. Saba closed the distance. She stopped just inches from the trembling calf, her towering frame blocking out the punishing sun and casting a living shield of shadow over the highly vulnerable newborn. The matriarch lowered her massive trunk. The highly innervated tip of it hovered over the iodine-stained umbilical cord, moving like a sophisticated biological scanner, inhaling the complex molecular memory of the clinical intervention, the sharp acidic sting of alcohol, the foreign salt scent of human sweat, the residual trauma of the cleared septicemia. She was processing the data mapping the topography of her calf's survival. For a terrifying minute, Marcus feared she might reject the infant based on the overwhelming chemical contamination. The boundary between human and wild is absolute, and nature has abandoned offspring for far less. But Saba did not turn away. The trunk shifted its focus, moving upward along the calf's flank, tracing the delicate curvature of the spine, feeling the steady rhythmic rise and fall of the functioning lungs. The tip of her trunk gently stroked the area behind the calf's ear where the intravenous line had been inserted hours ago, wiping away a single microscopic drop of dried blood with astonishing tenderness from a creature known for overturning ranger vehicles. She wrapped her trunk entirely around the calf's small torso, pulling the fragile infant flush against her massive front legs. Kidogo calf leaned into the solid, immovable mountain of its mother, finding the eternal comfort of the matriarchal anchor. The reunion transcended species boundaries, speaking the universal language of loss and loneliness that binds all sentient life on the savannah. Marcus watched a single tear of exhaustion streak through the thick dirt on Kofi's face. The quiet technician did not move to wipe it away. Saba of Samburu stood motionless for a long time, absorbing the living heat of her offspring, letting the cortisol levels in both their bloodstreams slowly return to a baseline of safety. Then slowly, deliberately, she turned her massive head toward the veterinary vehicle. Her amber eyes locked onto the dark windshield. She did not flare her ears in threat. She did not take a step forward to assert dominance. It was a gaze of pure, profound acknowledgement, a silent recognition that an unnatural boundary had been crossed and a life had been returned. She held the trans-species connection for exactly 3 seconds. Then the matriarch broke the gaze. She gently nudged Kidogo Calf forward, with a sweeping push of her trunk orienting the infant toward the thick protective brush of the deep reserve. With slow, synchronized steps, the mother and her newborn began to walk away. They did not look back. Their gray forms dissolved into the shimmering heat haze of the afternoon until they were swallowed entirely by the landscape that had birthed them. Marcus Thompson sat back against the cracked leather upholstery of his seat, letting the profound silence of the African bush wash over him. What they had witnessed was a living reminder that sometimes the most profound healing requires not just the mastery of clinical science, but the profound courage to step away. True conservation is the ultimate exercise in relinquishment, an understanding that what matters most isn't what we remember but what we feel, and that the greatest triumphs are the ones that end with an empty space where an animal used to be leaving behind, only the haunting beautiful silence of the wild reclaiming its own.